Level 5 Diploma in Leadership for Health and Social Care and Children and Young People's Services. Unit 4, Develop Health and Safety and Risk Management Policies, Procedures and Practices in Health and Social Care or Children and Young People's Settings. Enhanced Limited Copyright 2019. Legislation, Codes of Practice and Standards. Some aspects of the legislative framework you may be subject to in the work setting include Health and Safety at Work etc. Act, HSAWA, 1974. Health and Safety, First Aid, Regulations 1981. Safety Representatives and Safety Committees Regulations 1977. Manual Handling Operations Regulations, MHOR, 1992. Management of Health and Safety at Work Regulations 1999. Control of Substances Hazardous to Health, COSH, Regulations 2002. Reporting of Injuries, Diseases and Dangerous Occurrences Regulations, RIDOR, 2013. Health and Safety Executive, HSE. Approved Codes of Practice, ACOPS. Workplace Codes of Practice, Standards and Regulations. Health, Safety and Management in the Workplace. Policies and procedures in the workplace relating to health, safety and risk management are structured around the legislation and regulations mentioned on the previous slide. They help to ensure safety and management of risk for both staff and service users. Every care environment will have its own policies and procedures which are tailored to the needs of the organization. All employees should have read and understood these documents and how they relate to their own responsibilities. Generally, policies are reviewed and renewed on an annual basis to ensure compliance with current legislation and regulation. Demonstrating compliance is important as all practitioners within health and social care settings should aim to be a role model for others in the work environment. When considering how you can demonstrate compliance, think about the positive impact that this will have on practice. It is useful to read the health and safety and risk management policies in your workplace regularly, even if you think you know everything in there. Refreshing your understanding is valuable practice and ensures that you are always up to date on any changes. Attending all health, safety and risk training sessions is also really important for maintaining current knowledge and understanding to enable compliance. Supporting others. The people you might support in complying with legislative and organizational health, safety and risk management policies, procedures and practices include yourself, workers/practitioners, carers, significant others, visitors to the work setting, inspectors/regulators. This can be achieved through advising, mentoring, coaching and training. Failures to comply. If in doubt over compliance with health and safety or risk management procedures and practices, then take immediate action. Some organizations will have an appointed individual whose role involves ensuring that risk assessments are carried out and remain up to date. All employees, however, are responsible for following procedures and practices and must report any issues as they arise. This will often involve contacting the correct individuals responsible for addressing issues of health, safety and risk and making a log of the incident, as well as informing management. Records and reports. It is important that you are able to develop and implement reporting procedures in line with legislation and the requirements of the organization. For example, if there is a safeguarding incident, it is important to make accurate and detailed records and reports that follow the organizational procedures as required. Development and implementation. When developing and implementing policies, procedures and practice in health and social care settings or for child care services, it is particularly important to be aware of how risk assessment is used. You should also think about the relationship that this has to safeguarding. It's also important to keep all relevant legislation in mind, such as the Health and Safety at Work etc. Act 1974, so that you can be sure that you are complying with legal requirements. Holding regular meetings on the topics of health, safety and risk management is an effective way to make sure that you are able to gather recommendations from a wide source base. The 5 steps to risk assessment are: 1. Identify the hazards. 2. Decide who might be harmed and how. 3. Evaluate the risks and decide on precautions. 4. Record your findings and implement them. 5. Review your assessment and update if necessary. Assessing and managing hazards and risks. Working with a range of other people and organizations to assess potential risks, identify hazards and develop policies to manage risk in your area of responsibility may involve individuals accessing care or support, workers/practitioners, carers and domiciliary workers, significant others, visitors to the work setting, local area safeguarding boards, or equivalent, personal assistants. Balancing the management of risk with individual rights. It's not always possible or right to control everything that service users do in order to avoid risk altogether. Sometimes, for example, you might allow an individual with dementia to take their own medication because it will give them a greater sense of autonomy and control over their decisions. It's important to help others understand the importance of balancing risk and rights as it improves practice. Having clear discussions about this allows all involved to see the benefits of this and its positive impacts. Evaluating own and others' practice. Practice can be evaluated through reflective action. It is useful to analyze the benefits for improved practice of supporting colleagues and others to assess and manage risk. Obtaining feedback. The types of people that you can gain feedback from in relation to health, safety and risk management policies, procedures and practices include staff, individuals, carers, significant others, domiciliary workers. It is beneficial to hold formal reviews of health and safety performance on a regular basis to establish whether the core principles have been embedded in the organization, therefore letting you know whether your risk management systems are effective in protecting people. Examine this diagram for delivering effective arrangements. Identifying improvements and recommending changes. In order to identify improvements to be made, it is important to keep up to date with health and safety issues. There may also be times when you need to recommend changes to policies, procedures or practice in the context of new and emerging health, safety and risk management issues, such as staff changes or behaviors of service users. If you would like to cite this presentation in your work, please use the citation template below.